Good morning one and all. Today I am going to discuss about pit and fissure sealants. Okay, why it is important? Because pit and fissures are more prone for the dental caries, and caries risk is nowadays very high. So to prevent the dental caries in the initial stages, giving the pit and fissures to the newly erupted teeth is very important, and to prevent the burden of the oral diseases. Okay. Objectives of my topic are, first one is the understand the indications and contraindications of pit and fissure sealants, to understand the procedure of pit and fissure sealants, to understand the evidence-based clinical practice guidelines for use of pit and fissure sealants. Last one is the to know the recent advances in pit and fissure sealants. These are the objectives. Okay, that is target of my topic. Contents of my topic are introduction, definition, history of pit and fissure sealants, composition, morphology, ideal requisites, indications, contraindications, procedure of application, evidence-based clinical practice, recent advances, conclusion, references, suggested readings, frequently asked questions, multiple choice questions. Introduction. Dental caries and periodontal diseases are common dental problems, and pits and fissures are more susceptible for the dental caries. Among all the surfaces, occlusal surfaces percentage is 12.5%. Caries incidence among occlusal surfaces is 2/3 of all the surfaces. And morphology of the pit and fissure is also prone for the dental caries. In the definitions, pits and the fissures and sealants I am going to discuss. Okay, pits are the pinpoint depressions at the junctions of developmental grooves or terminals of the developmental grooves. Fissures are the grooves between adjoining cusps. Sealants are the materials introduced to the pits and fissures. Thus can form micromechanical bond and form a protective layer above the pits and the fissures. Thus prevent the entry of the caries forming bacteria from the source of nutrition. Coming to history of pit and fissure sealant, we can discuss about the Hayat now. Okay, Hayat introduced a word that is prophylactic odontotomy. Prophylactic odontotomy is nothing but sealing the pits and the fissures as soon as they erupt into the oral cavity, sealing with silver and copper oxyphosphate cements. When teeth are fully erupted into the cavity, they can be sealed with, the cavity has to be done, they can be sealed with the amalgam. Bodecker introduced fissure irradiation. Fissure irradiation nothing but widening the deep narrow fissures. Bonocker developed a bonded resin for the pits and the fissures, and first resin experimentally used in 1960s. Bowen developed BIS-GMA in 1965. First colored sealant introduced in 1976, that was the white color sealant. Next one is Burt reported that first and second molars should be sealed as soon as they erupt into the oral cavity because they are prone for the dental caries. Eccles in 1989 stated that pit and fissure sealant materials are used preventively for the caries prone teeth, therapeutically for caries tooth or incipient caries. This is the classification of pit and fissure sealants. Okay, based on the polymerization, based on the filler particle, based on the color, based on the resin system in that. According to the polymerization system, there are two types: self-activated and light-activated. Light-activated, again 4 types: first generation, second generation, third generation and fourth generation sealants. Based on the resin system, there are 2 types: urethane acrylate and BIS-GMA. Based on the generation, first generation sealants polymerized by UV light at a wavelength of 350 nanometers. Second generation sealants are chemically cured. They are initiated by the catalyst accelerated system. Example for second generation sealants, those are chemically curing sealants are Delton. Delton and concise both are the examples for second generation sealants. Third generation sealants, they are polymerized by visible light at wavelength of 430 nanometers to 490 nanometer. Example is Fissure Delton. Fourth generation sealants are fluoride containing sealants. Example is the Delton Plus. Based on the filler content, silica and quartz glass are used as filler particles in the pit and fissure sealants. There are two types. First one is the unfilled resins. Okay, advantages with unfilled resins are they flow easily, retention is more. Only one drawback with the unfilled resins is they can abrade easily. Filled resins, strength is more. Disadvantages with the filled resins are we need to adjust the fissure sealant after application. We need to check for the high points in the restoration, and they are more resistant for wear. Okay, that is the advantage with the filled sealants. Based on the translucency, clear and tinted or opaque. Like clear sealants, okay, they are well appreciated by the patients. Okay, they can flow easily. Tinted and opaque sealants, they are colored. They can be appreciated during the procedure and during follow-up visits. Based on the resin system, BIS-GMA, urethane acrylate. BIS-GMA is the chemical component of bisphenol A, urethane methacrylate, glycidyl methacrylate. What are the ideal requisites of a sealant? According to the Brauer, okay, sealant material should be good in the viscosity. A viscosity allowing penetration deep into the fissures, adequate working time, less curing time, prolonged adhesion to the enamel, resistant to wear, minimal irritation to the oral tissue, and karyostatic action. Composition of pit and fissure sealants. First one is the resin matrix, that is BIS-GMA, urethane ethyl dimethacrylate, triethyl glycerin methacrylate. Filler particles are silica, glass, and colloidal silica. Coupling agents are titanates and zirconates. Opacifiers are aluminum oxide and titanium oxide. Coming to morphology of the pit and fissures, first one is the V1, okay, V-shaped fissures. Next is U, I, and Y. V and U are self-cleansing. They are less susceptible for dental caries. I is susceptible for dental caries. It appears like a bottle. Okay, they tend to open in a wide base. Y-shaped fissures are more prone or more susceptible for the dental caries. Percentage of V-shaped fissures is 34%. Y-shaped fissures percentage is approximately 13%. Indications of pit and fissures sealants. First one is the newly erupted primary molars, newly erupted permanent bicuspids and bicuspids and molars, and sticky grooves. And second one is the stained fissures with minimal decalcification, and deep regular fissures and foci, and no clear radiographical evidence of dental caries. Patient with high risk to moderate risk of developing dental caries. Patient with the incipient caries, and anatomically susceptible pits and the fissures. Contraindications. Contraindications are well-established cavitated lesion, okay, uncooperative patients. Along with that, large restorations on the occlusal surface or on the proximal surface, proximal caries, and life expectancy of the tooth is very less. And self-cleansing pits and the fissures. Those are nothing but U and V fissures are not indicated for the pit and fissure sealants. One more contraindication is when patient is allergic to sealant, dental sealants. And patient is too young to cooperate for the dental treatments. And patient with the porcelain restorations, patient with the amalgam restorations, patient with the inlays, onlays and crown and bridges are contraindicated for the fissure sealants. You can see the procedure of application of pit and fissure sealant. Okay, first one is the cleaning of the tooth. Next one is the isolation of the tooth. Next is the etching of the tooth, rinsing the tooth. Next one is application of the bonding agent, application of the sealant material. In detail, I am going to explain in my next slides. Procedure of application. Okay, here you can see the instrumentation of the pit and fissure sealant placement. First one is the airway syringe, that is two-way syringe. Next one is the mouth mirror, explorer, excavator, gauze, cotton rolls, cotton pellets, forceps, articulating papers, curing light, handpiece, dap and dish with fumes. In the procedure, first step is polishing and cleaning of the teeth. Okay, cleaning is important because debris and calculus which is present on the tooth surface might interfere with the etching process. After cleaning, polishing is done with the fumes. Isolation of the teeth and drying of the teeth. After cleaning, dry the tooth and isolate with the rubber dam. Etching. Third step is etching. Okay, etching is done with 37% of orthophosphoric acid for 15 to 20 seconds. Okay, etching should be done a few millimeters above the fissures, pit and fissures. After etching, next step is the rinsing. Rinsing is done with airway syringe for 15 seconds. Next step is the isolation of the tooth. Okay, drying and the isolation. Sixth step is the applying bonding agent. Apply bonding agent and cure the bonding agent. Material application is the next step. Okay, apply fissure sealant and caution should be taken to avoid bubble interaction into the material. And after application of the material, cure it for the 10 to 20 seconds. Evaluation of the sealant. Okay, after application, evaluate sealant visually and tactile. Next is check the occlusion. Check for the occlusion. Okay. Next is periodic recall, periodic maintenance of the patient. Give periodic recalls. Call the patient based on the your treatment. Okay, give follow-up visits and check for the sealants. These are the recent advances in the sealant. ACP releasing sealant, enamel lock, embrace. Okay, ACP releasing sealant is this is the strongest one. Okay, enamel lock, this is self etching sealant. Okay, next one, it can release the fluoride. Embrace wet bond, it can adhere to the wet surfaces. This is useful for the patient with the gag reflex. Suitable ages for the fissure sealants. Okay, 3 to 4 years for the primary molars, 6 to 7 years for the first permanent molar, 11 to 13 years for the second permanent molar. These are the suggested age groups for sealant placements. Okay, now I am going to discuss about preventive resin restorations. Okay, preventive resin restoration is nothing but logical extension of the pit and fissures. Okay, if there is a cavity or incipient cavity in the fissures, okay, we can go for the preventive resin restorations. Okay, you can see the steps in the indications. Indications in the indication. First one is the incipient cavity in the fissures. Okay, and minimal catch. Steps in PRR. Steps in preventive resin restoration. First one is the removing the caries lesion by using the small round burr. Okay, after removing the caries, Okay, give the composite restoration. After composite restoration, fill with the fissure sealant. Conclusion. Coming to conclusion, dentists should take active part in preventing the dental diseases, because this is the burden for the nation. Okay, incidence of dental care is increasing day by day. Okay, dentist has to take vital role to prevent all this by giving the pit and fissure sealant. This is the primary preventive measure to prevent the dental caries. This is the video link, and these are my references. All these are suggested readings. Frequently asked questions from this chapter, they are: define pit and fissures, classify pit and fissure sealants, enumerate the steps in application of pit and fissure sealants. Short notes which are asked from this chapter are: indications and contraindications of pit and fissure sealants. Next one is the preventive resin restoration. These are the questions asked from this chapter. Multiple choice question. These are the multiple choice questions.